Hope you're doing okay. My name is Noella Tenku, and today I'm going to be sharing you a solution, a prototype Group 66 have been working on. And our GCGO that we focused on is healthcare. I'm going to go now to share my presentation so you won't see my face again. All right. My team and I have been working on a solution called TechCare, which helps you with your health journey. And today I'm going to talk about how we came about this solution, which is usually based on preventive care and early diagnosis, and how technology is an enabler for preventive care with our solution. And then I'm going to talk about some key considerations we considered when working on this solution. And lastly, I'll talk about the growth and business opportunities behind our solution. Okay. I don't know if you've come across preventive care and early diagnosis, but it's a part in healthcare where the focus is on things to help you before you eventually fall sick. So preventive care is not when you're at the hospital, but it's about the things you can do before you get sick so that you are not vulnerable to certain kind of diseases. Okay. I'm now going to talk about some key facts of non-communicable diseases in Rwanda. I don't know if you know about non-communicable diseases, but this is a group of four main diseases known as cardiovascular diseases, chronic respiratory diseases, diabetes, and cancer. So, did you know that 59% of mortality rate is caused by non-communicable diseases? That is sorry, one in every two deaths in Rwanda is caused by these kinds of diseases. Did you also know that 40% of adults get diagnosed for the first time with any heart disease at a late stage, which usually requires surgical interventions? This means that 4 in 10 people, the first time they go to the hospital because they are sick and they have a diagnosis of heart problem, they immediately require surgery. This is not normal. This should not be the norm. Did you also know that each year 2,000 Rwandans die from diabetes and high blood glucose? And sadly, this is projected to increase. And guys, this is not in old people, this is not only in obese people. This is the statistics between 20-year-olds and 65-year-olds. And this is because the government says this is because people are not aware of the symptoms. They're not educated enough to think that, oh, if I have this symptom, it's diabetes. No, they don't know this. Why am I zoning in on this? Why am I talking about this disease in particular? This is because non-communicable diseases are diseases that are not spread through infection or through other people, but they are typically caused by unhealthy behaviors and genetics. Highlight on unhealthy behaviors. This means that we can prevent these kind of diseases by a change in lifestyle, by the change in the activities that we do, by a change in the things we eat. We can prevent these diseases and reduce the mortality rate. With all of these facts and data, our team came up with the problem statement, which is the failing to adequately promote preventive care and early diagnosis, which leads to preventable illnesses, increased healthcare costs, and poorer health outcomes for individuals and communities. How many people do you know that had a huge, health crisis in their family, and this just brought down the entire household income of their family, or they spent a huge chunk of family money on treating one disease or the other? This just leads to poorer standards of living for people. So this is the problem statement our solution is focused on. And as we're doing more research on our problem and what it encompasses in Rwanda, we found out that Rwanda has a national strategy action plan for NCDs. And they say that investing now in prevention would lead to savings in the future. Investing now will lead to savings. This is the government saying this, even though they have planned to spend about 358 billion Rwandan francs on this topic, that is in prevention, in screening, in diagnosis, in treatment, and in raising awareness. Guys, it means this is a huge expenditure for the government. And in their strategy plan, their number one priority is raising awareness and education to reduce the exposure to risk factors on NCDs. Again, in this strategy plan, the number one action line of action, which is priority, the number one action in priority number one is using digital solutions to raise awareness and support the prevention of NCDs. With these statistics, my team and I tell you that our queue to work on this solution. The government is already in on in. The government is supporting solutions on this regard of raising awareness and in preventive care. This led us to coming up with our solution, TechCare. And TechCare is your personalized health assistant. TechCare, what TechCare is, our solution. TechCare empowers you to take control of your health with its AI-powered chatbot. How does tech care do this? It has two main factors. It helps you to identify potential health risks. So when you log into our platform, you list your symptoms and you give relevant health data and vital statistics. We can provide personalized insights into potential risks and preventive measures you can take based on your information. Everything is personalized to you. Another thing that TechCare will do after receiving this information from you is to provide personalized recommendations such as activities, wellness and fitness exercises, checkups, and the kind of doctors and hospitals you can go to for medical care based on your needs and location. Young people, older people, people with any kinds of problems, any kind of symptoms that you have that may especially be related to one of these NCDs. Tech care can help you to identify these and take preventive action against eventually reaching critical stage in such diseases. Right now, I'm going to present to you a prototype that we made on Mirror. So this is our prototype that we made on how our solution looks and feels like. The first page is our login page. On this page, you would give your, register for the app with important information. Then you have this page where you have to give your personalized information. This is, your age, your age, your weight, underlying diseases, past diseases in your family, everything that can help the chatbot to give you more personalized recommendations on your health. Now, when you give all this information, you have options that can lead you directly to pharmacies, health experts, or nearby centers. But the main feature we're highlighting is the chat with our AI. And this chat with our AI, you have the option to continue to chat on the app or to go on WhatsApp. When you get a link to go on WhatsApp, you can chat with our app. It gives you some recommendation. When you give in more information, it's going to generate for you at the end of that conversation a link back to our app, and this link would contain recommended doctors you can visit, recommended activities you can do, recommended wellness centers. All of this is based on the information that you've given us and your location. Again, more information on the clinic, the hospital, and where it is found. Lastly, if you get to visit that hospital, we would invite you to rate the hospital, rate the center, rate the wellness and fitness activity that you took. This is going to help us to have credible sources on our app so that we can recommend it to other people who may have similar symptoms or who are interested in visiting so and so such a place. Lastly, what our app can provide for you with your information is statistics on your health data and the activities that you've been able to do. Any preventive care measure you've taken, our app will help you to provide these statistics. That's all about our prototype for now. Moving on, here are some key things we considered in the development of our app. Number one thing is data transparency and explainability. Most of the times, people want to know how is the AI generating its responses, and also what separates it from Google, where you just go and type your symptoms and get a random diagnosis. The difference and the important thing with our app is that our AI will be trained with localized data on your country's epidemiology, environmental factors, and care pathways. In addition to that training that we will give on our, we will use on our AI, we are going to have a medical team in the loop where we have doctors who will intervene, provide oversight on the responses that the AI is generating to ensure that the chatbot is giving you accurate responses. Another important consideration in developing our app is data security and data privacy. For data security, we are going to ensure end-to-end encryption as you're chatting with our app, and we're going to make sure that your data on our servers are adequately secured. And for data privacy, we would obtain explicit consent from our users before collecting and storing their data, and we're going to provide clear privacy policies on how your data may be used and shared. Now, with all of this, how do we want to sustain our solution as a business? What are the possible ways we could make money to run and finance this solution? Their number one thing is that healthcare and medical research centers by providing licensed, anonymized user data. So this data is going to be anonymized. We're not going to provide any data that is going to link to any individual on our app. We're going to provide anonymized data for research and to improve advancement in healthcare. This is some way we can generate income. Another way we can generate income for our business is to partner with healthcare providers to analyze user data and provide valuable insights to population health trends and disease patterns. This is going to also enable healthcare providers to tailor their solutions and services more effectively. Lastly, another business opportunity that we have is in wellness and fitness. With our app, we can partner with insurance companies to provide discounts and rewards to users who actually engage with the preventive healthcare measures our app TechCare recommends. We can also partner with gyms, fitness, and wellness coaches to provide personalized exercise and lifestyle recommendations based on their health data and their goals they have provided in the TechCare platform. Last but not the least, and most importantly, is community building. Our app is going to create a community where users can connect, share experiences, and access exclusive benefits from our partner brands. We believe that by implementing such solutions by 2025, we can reduce mortality rate by at least 10%. Thank you all for your time. Thank you for watching this video. We hope that you can give feedback to our solution and hope that you can engage with us. Thank you. Bye.